My presentation is not about digital health or e-health or EMR. It is very much about the challenges, though, that is before the New Brunswick publicly funded health services. I won't say healthcare system. It's been one of my pet peeves for the last 6 years that I've been in healthcare. We don't have a system, but I think it will link up to some opportunities for our discussions. How do we proceed for it to change the slides? Oh, it's right here. Perfect. Excellent. So the system is very much institution and professional centered. It is that way. It's not citizen centered. I'm not saying that. I've heard it over and over and over again. I'd love it if someone doesn't agree with that point to tell me why they don't agree, but it's something that's said over and over again. So we have to have a clear sense of health outcomes, of service outcomes. That's how we within the system that our language really focuses towards citizens. The New Brunswick context is that we have a very rural province. We also have an aging province. We say we age faster in New Brunswick than the rest of the country. I had a problem with that, but but you have to understand out-migration. A lot of our young people move out west. That's why we age faster than the rest of the country. And there's a lot of in-migration happening as well from the north towards the south. So when you look at this map, first of all, 32% of New Brunswickers over 55 compared to 28% in New Brunswick. And the northern part of New Brunswick, those darker areas, much higher proportion of older citizens. A lot of in-migration from the north of the province going south, so from Campbellton, Edmundston, for those familiar, around Moncton particularly in the last 10 to 15 years has been quite an economic hub. We need to make a shift from acute care to primary care. We hear that a lot. The chronic condition issue in New Brunswick is a key dilemma. If you look at ages 18 to 34, it's 37% who say they have one or more chronic condition, 54%, 35 to 54, 55 to 64, 76%, 65 and over, it's 87%. So we're talking here arthritis, asthma, chronic pain, COPD, cancer, high blood pressure, etc. We've just completed a diabetes clinic assessment that'll be made public in a few weeks. Unfortunately, these types of exercise aren't even the norm. We're arm's length, so we have to sign MOUs when we get into this, and we have conditions. And one of our conditions is whatever we do has to be made public. Not the norm, right? But for us, it's non-negotiable. 2 years in the project, the question was, where are these clinics? Okay, so it tells you just as a system how aware we are of what services we have and where they are and how they work. A lot of key points around the value of these citizen-centered principles, similar to some of the elements we saw in the US slides. Particularly interest for us is we've actually costed these clinics, which varied from $30 to $160 per visit. The $30 clinics were delivering the best results. Okay, so it's interesting to see that. So it's all around the principles. It's not necessarily around the technology and what you have around that, but it's really much about being citizen-centered. In particular interest to us from, why is this just popping up over? Oh, there we go. 40% of citizens say that they have control. They understand how to control their chronic conditions. 40%. So that's an opportunity. It's also an opportunity, but about 40%. Access to primary care. New Brunswick is a very top performer when it comes to having access to a family physician. 93% compared to 85% in Canada. And also, when it comes to having an appointment within 48 hours, we 34% in New Brunswick compared to 41% in Canada, and Canada does not compare well to many, many European countries on that note. So not having these appointments within 48 hours, I can show you maps of New Brunswick where we look at parts of the province with the highest proportions with a family doctor, the worst results in getting an appointment in 48 hours, and the highest proportion of people in ER for 4s and 5s. So we're not using our resources the right way. When we look at ambulatory care sensitive cases, preventable hospitalizations, New Brunswick is at 460 per 100,000, Canada's at 290. This speaks to obviously high prevalencies of chronic conditions in our population, but also not appropriately managing these conditions and the impact it has on bed use across our province. We now have at the council more regional, more local numbers. We're seeing the impact of that for the system and our health system managers. This is new. They're not used to looking at these types of numbers. Why? Because it's not a culture of being focused at the results of our clients, of our patients. The local quality indicators is really the next challenge for us. So we have these issues. Is it because we don't spend enough in New Brunswick? Well, if we look at staffing, we're at 2,600 in New Brunswick compared to 2,000 in Canada. A lot of people will say it's because we're rural. I'm not sure that explains it. I'm not sure that explains to why it's to this extent. We compare well to the rest of the country when it comes to the number of professionals. Here you have doctors, specialists, nurses, 1,000 compared to 700, and auxiliaire. I'm like a Chrétien, I put the emphasis on the wrong syllable. So with what we have in New Brunswick, we should be getting far better results with what we have. But we've been kind of trained in that we have problems because we don't have enough. And if everybody's so busy, they don't feel like they have enough. And bringing this information in front of professionals in the province, how many clicks does it take? There we go. Has been an eye-opener for many people. Hospital beds, we're at 38 versus 23. And 23 hospitals for 750,000 people. Quality of care is associated to hospitals, and the bigger the hospital, the better care. Diagnostic technology, I'd be going much quicker if the thing clicked faster. On MRIs, we compare very well to the rest of the country as well. CT scanners, MRIs were slightly lower, but there's been promises and will be above Canada very shortly. Public sector spending. New Brunswick, 40% of our budget is federal transfers. It's also about what's healthcare. We spend more than the national average. In 2004, we were at the national average. We've grown by 6 to 7% since. Same as for the rest of the country, but our population has stayed the same. We've not grown our population, but we've grown the spending. So a recent study that we had with the Canadian Institute of Actuaries assessed that future growth for us by demand pressure is about 4 to 4.5%, assuming that we'll continue increasing spending in healthcare by, let's say, 2 to 2.5%. We've got to find efficiencies for about 2% every year. That's the bottom line. So it's not about putting new money in. It's about finding efficiencies. The good news is we seem to have a lot of resources. So it's really about using these differently. So in closing, it just so happened this week that the Medical Society was out about EMRs in New Brunswick. They've wanted to own the project early on. They're short on targets. Part of the message is we'd probably get better buy-in if it was free. There's a March 31st deadline in getting financing, and it doesn't look like we're going to get there. So for us, from a New Brunswick perspective, really knowing that the province can't put more money in, really, we got to really seriously look at where's the money going to come from to make these changes that we need to make. That's it. Thank you.